Hello and welcome to this week's What Were They Thinking? We begin with what is likely to be the high point for this week's installment of What Were They Thinking? It's about a factory that has had its workers engage in a sort of lock-in for just under a month in order to produce raw materials that can be converted into N95 masks and surgical masks at a factory just off the Delaware River in Pennsylvania. It starts on the 23rd of March, where for the next 28 days, the workers would eat, sleep, live, and produce the raw petroleum products that are needed for these masks that are so sorely in demand. The 43 workers not only volunteered for this, but also were rewarded for their efforts by the company that owns the factory. Although it has not been disclosed, we have been made aware that they were compensated not only for their 12-hour shift, but also for staying in the factory. You might wonder why they were staying there, and it's simple. By not leaving and ensuring everybody who was there is healthy, they prevented the possibility of anyone becoming infected, which would have either diminished production or possibly shut down the whole factory. Doing as they have hasn't done more than just produce goods though. It's the amount they've produced and what they calculated it to mean. They claim to have produced 40 million pounds of polypropylene. They estimate that that's enough to make 500 million N95 masks or 1.5 billion surgical masks. Of course, we don't know if that's solely what it will be used for, but if it is, that is a huge increase. In theory, it's enough to support the healthcare workforce for the immediate future. Going from that high point, we immediately plummet to alarming depths, with Facebook releasing an interactive map that tracks the CCP virus symptoms in your area. Yes, Facebook, well known for its privacy violations, is now allowing you to track the symptoms for the CCP virus around you. Although it doesn't rely on invasive surveillance as Facebook's been accused of, and in some cases admitted to, the map is still somewhat disconcerting. It relies on survey data from the Carnegie Mellon University. Fundamentally, it takes that data and plots it out on a geographical map. This can be updated almost daily by Facebook. Facebook is able to do this as it has access to 2 billion users across the world. It runs these surveys and claims that it sends the raw data to Carnegie Mellon, whilst they only get the aggregate distilled results, which, given what we know of Facebook, with events like the Cambridge Analytica scandal, seems an optimistic interpretation of what might be happening. They currently only provide data for America, but plan to expand it to include other countries in the coming weeks. The data they're getting isn't all bad, and in fact could be very important in certain decision-making schemes, two of which are currently under contention. One is whether or not to reopen businesses and borders. The second is who and what gets certain resources. The prevalence of symptoms could be a good indication that an area is not yet ready to reopen its borders or enter into relatively normal business practices once more. The other side of that is whether or not hospitals are prone to be receiving a sudden number of patients reporting these symptoms who will need to be tested and who will need to be given appropriate treatment. That is all the more concerning when you think about what the CDC is saying at the moment. Expect an increase to the CCP virus population in winter that is worse than what they're encountering now. According to Robert Redfield, who is the director for the CDC, said that the US appeared to be nearing the peak of cases for the current outbreak, but that a second wave could be worse. This is from an interview found in the Washington Post, and although the Washington Post is a questionable publication at times, taking what they've extracted of that interview from Robert Redfield, it would be fair to say that America is on the cusp of even greater trouble than they are now. Remember that when America first became concerned about this, they were coming out of winter. People were spending more time outside. They were less clustered in small environments trying to get warm. If we go forward and look at it going into next winter, people will be in confined spaces if they're back at work. There'll be more issues with people who have developed other diseases, such as influenza. And there'll be a variety of other factors that will increase demands on the medical system. Most hospitals were already having some trouble in winter coping with the number of patients in a variety of ways. But when you add in the CCP virus, suddenly the entire medical system is going to be massively overwhelmed to an extent that makes the problem seen now in places like New York seem petty. The disconcerting part is it's unlikely we will have a vaccine any time before this winter resurgence. This is one reason why he's strongly advocating that people get their seasonal flu shots. Looking at possible treatments and ways to mitigate the spread of the CCP virus, we do have a lot of human clinical trials running at the minute. One of these involved Remdesivir, a product made by Gilead Sciences. The problem with this study is that they unintentionally released early results in a post that's been deleted. The results of it fundamentally say potential benefit, which is the polite way of saying we're not sure what we found. The study involved 237 patients, which is nowhere near enough to produce definitive results regardless, but it's at least a good indication from the way they've designed it. There were 158 patients given the drug and 79 who were not. The problem with this is, of those two groups, 13.9% of the patients who were given the antiretroviral Remdesivir died, versus 12.8% of the patients who did not get the drug. To begin with, that difference is not statistically significant. Second, it is a very small cohort. As per the statement by the Gilead spokesperson, it was terminated due to low enrollment rates, and they felt it was not statistically meaningful. And, based on our understanding of statistics for this kind of study, that's a correct position to hold. Without statistical power, the study could well have found the anomalous results they did, or these could have been correct with the larger picture. Unfortunately, there is no way to know this without having that statistically powerful study behind it. Another clinical trial is just about to get underway, this one being run by Oxford University in the UK. It's looking at just over 1,000 volunteers in its first phase. It's 1,112 volunteers who will receive a potential vaccine. Half of these will be given that, and half will not. This study is statistically powerful, and the results from it should show us what we need to know. The important caveat to it is that the volunteers have not tested positive for the CCP virus. This is very different to what they were doing in China, where the Chinese patients had tested positive. If successful, it would be a prophylactic treatment in a similar way to what the influenza vaccine, the measles vaccine, and others do. They either reduce the severity or prevent you from getting the disease. The reason this study is so impressive, if successful, is the plan to have over 1 million doses of the vaccine available by September if they get an 80% success rate. That would mean by the time the Northern Hemisphere has to be concerned about the weather changes in autumn, they should be able to provide a significant amount of coverage to the population. Admittedly, nowhere near enough to cover the whole population, but it would certainly be a strong start. Unlike, say, the hydroxychloroquine projects, this is based on a slightly more substantial body of evidence. It uses an adenovirus from chimpanzees that has been modified to produce the proteins that are made in human cells when they are infected by the CCP virus. This is very similar in many ways to how the influenza vaccine is created. If successful, it would teach the body how to identify and then to respond to the CCP virus. We also have an interesting article coming out of the conversation this week. It was looking at why men are dying at a significantly higher rate than women are. Approximately 60% of those who are infected with the CCP virus and die are male. The results shift slightly based on age group, but the trend is the same. This means men are more prone to dying if they are infected with the CCP virus, and we've been trying to figure out why. The conversation posits their theory that it all boils down to the presence or absence of X chromosomes. Do you have 2 X chromosomes or 1? Normally, humans are either XX or XY. XX is female, XY is male. The Y chromosome produces a number of different products depending on whether or not it's active. The most important of these being testosterone. Females produce significantly less testosterone and instead produce estrogen. This difference and the distinction between sexes in diseases is well known and well established, especially when we look at cardiovascular disease. Trying to understand what exactly is happening hasn't been easy, but we have some knowledge about the distinction in what the 2 chromosomes do and how that would affect different disease states. It can also have an effect on the immune system. As a broad rule, women have better immune systems than men do. This therefore means they're more prone to autoimmune diseases, but also more resilient to other diseases. The theory put forward by the conversation is sound and looks to be consistent with other patterns we've observed, but we may not yet know whether it is the whole story or simply a large part. Next, we have the increasing number of cases of pets becoming infected with the CCP virus. As has been said repeatedly before now, there have been instances of animals testing positive for the infective agent. In Hong Kong, this figure has risen drastically since we last mentioned it, where we had 2 dogs. Now there are 17 and 8 cats. That's not a good sign with an increasing number of pets being infected, but it does get more disconcerting. There was research done as to whether or not animals could spread it to other animals, which does in theory include back to humans. They did this by infecting kittens with the virus. After they were infected, they then waited to see what happened. 2 of the kittens died, and 3 that were considered to be adolescent became ill but were able to recover. They also noted that cats can spread the CCP virus to other cats. Dogs were a little different, and they found that they were both more resilient and unable to transmit the virus. Both the CDC and the World Health Organization seem to be in agreement that it is unlikely that you would catch the CCP virus from your pet, particularly your cat. However, There are practices you can take that would minimize your chances of harm. These are things we've mentioned in the past regarding salmonella, washing your hands, not letting them lick your face, and so on. While it's possible for your dog or cat to catch the CCP virus, others are being trained to test people for the CCP virus. Much like dogs that have been trained to try and detect cancer or bombs, the London School of Hygiene and Tropical Medicine is trying to use medical detection dogs to identify patients who may yet test positive for the CCP virus. They're trying to understand whether or not it can be done reliably or done at all. Currently, they're looking at 6 dogs in an initial trial. It begins by giving them face masks from patients who have had the CCP virus. The hope is that there would be a unique odor that the dog can pick up, identify, and be trained to respond to. We won't have any results from this particular experiment for several weeks, as it will take time to get the animals up to speed. This could be especially powerful as a tool given the lack of test kits, the unreliability of test kits, and the difficulty in which they can be done, some taking minutes, some taking days. If a dog can provide at least a preliminary indication of whether or not you should be given a test, you can go into isolation and minimize the spread of the disease. Minimizing the spread is only a temporary solution. In one other bit of CCP virus-related news, it would appear that the virus is at least partially responsible for a significant increase in blood clots. This is a problem especially in the elderly or those who have cardiovascular diseases, who are already at a significant risk. Combine this with the respiratory effects that it has, and patients who are infected with the CCP virus face a battle on multiple fronts to not only recovery, but survival in general. We need to get a vaccine, and that's not going to happen anytime soon. This is why the Gates Foundation is putting forward an extra $150 million. This is intended for the development of therapeutic agents and treatments for the CCP virus. They recognize that it could take a year or more to develop these in a safe and efficacious manner, but they are putting the money forward to get it done. The reason they're pushing so much money into this is that rather than the normal hundreds of millions of doses of a vaccine or similar that are being developed, they need to produce billions. If we don't vaccinate globally, then the chances are good that the disease will be retained in reservoirs of humans that will regularly break free and cause mass infection again. Think of it as a similar thing to what happens with Ebola. Ebola was effectively contained for a time, and then a few cases will get out and cause it to spread again. Similar things occur with SARS. SARS breaks free from its reservoir in wildlife on a regular basis. Then the people who are infected need to be contained, treated, and regularly die out, leaving the disease with no possible host. Although the Gates Foundation's efforts are admirable, it's those by lay people who don't have the kind of knowledge needed that is disconcerting. The efforts to try and sanitize your home, office, and similar has led to a significant increase in the rate of poisonings in the United States of America. We're not talking about things like the aquarium-grade chloroquine poisoning, but instead the use of more mundane and everyday sanitizing agents that are being used inappropriately, ineffectively, or in a way that has led to people becoming poisoned, primarily through chemical exposure. In the roughly 3 months since America had to be concerned about the CCP virus, there has been a 20% increase in the number of calls to the Poisons Helpline. That is a massive jump. The reality is that the correlation is simply too strong to ignore. Take this example. Paramedics were called to help a child who had become dizzy, fallen, and hit her head. When she was taken to the hospital, they found that her blood alcohol level was 273 milligrams per deciliter, or more than 3 times the legal limit for an adult. That's a big issue when you think that she was poisoned by drinking ethanol-based hand sanitizer. In another instance, a woman became poisoned by breathing in chlorine fumes when she used hot water and diluted bleach. The heat caused the chlorine to sublimate and become a gas. She then breathed it in, which causes damage to your lungs. Chlorine gas is what was used in World War I for mustard gas, and that led to massive issues and required the issuing of gas masks. Although that woman is likely to have been injured quite seriously and may yet recover to her original lung capacity, we have another case study in which a woman was saved by her breast implant. The silicone breast implant protected her by catching a bullet that she was shot with. The Canadian woman was shot for reasons that have yet to be explained in detail. The 30-year-old woman suffered what was described as severe chest trauma after being struck by a bullet. She was supposed to have been walking down the street and suddenly felt heat and pain in her chest. Being examined in the hospital revealed an injury and a bullet hole, but otherwise she was in a stable condition. The burn injury was because she was shot from extremely close range. Normally this would result in one of two things: a bullet entering the body and spalling, causing damage further in, or exiting the body on the other side and causing a lot of damage on the way through. In this case, neither of those happened. The bullet was inside their chest, but inside the breast tissue. It had fractured a rib, and it had caused a bit of other damage in the form of pulmonary contusions, that is, damage to the lungs, but it had never gotten through the rib cage. The damage itself appears to be from the force of the shot. The surgeons conducted a CT scan and then removed the damaged implant. They were able to identify both the caliber of the bullet and provide it to police. They were also able to retrofit a model of how the bullet hit her, and there was concern that if the implant had not stopped the bullet, it would have gone through her heart. Going now away from case studies, there's a bit of confusion over whether or not the world is facing an insect apocalypse. Are butterflies dying? Are the bees disappearing? Many questions about what is happening, and a lot of studies produce conflicting results. Taken in isolation, you can cherry-pick any results you want. Taken collectively, there are two very different trends depending on what biome you look at. One study's attempted to do this by compiling 160 surveys examining the distribution of insects going back to 1925. They've identified two different trends: those that live on land and those that live on or near water. Land-based insects are decreasing at a rate of about 1% per year. Water-based insects are increasing at a rate of about 1% per year. That broad distinction isn't particularly helpful, as we don't know what areas within the aquatic and land-based insects are increasing or decreasing properly, and therefore conservation efforts aren't going to be easy to implement. And, as is somewhat stereotypical, more research is needed. Speaking of the environment and ecology, bald eagles have been found nesting in saguaro cacti for the first time since about 1970. This is thought to be evidence of the success of conservation efforts, particularly in Arizona. In Arizona, there were thought to be only 11 breeding areas, and there were a relatively small number of eagles. In 2019, they counted at least 89 nests, being a strong indication of at least 168 breeding pairs. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions below.